How does inflammation cause COPD airway narrowing? Imagine your lungs as a busy city with tiny roads that let air flow in and out. When you have chronic obstructive pulmonary disease, or COPD, something causes those roads to become tighter and harder to pass through. The main culprit is inflammation. When you breathe in irritants like cigarette smoke or pollution, your lungs react by activating immune cells. These cells, including macrophages, neutrophils, and T lymphocytes, rush to the scene and settle in the airway walls and lung tissue. They releases chemicals called cytokines and proteases that are meant to fight off the irritants, but they also cause damage. This damage leads to several changes that make the airways narrower. First, the walls of the airways become thick and swollen because of increased cellular activity and fluid buildup. Fibroblasts, which are cells that produce scar tissue, get activated and cause fibrosis, or scarring, which stiffens the airway walls. Next, the muscles around the airways, called smooth muscles, grow larger, making the airways even narrower. In addition, inflammation stimulates the goblet cells and mucus glands to produce more mucus than usual. This excess mucus can clog the airways, making it harder to breathe. The inflammation also damages the tiny structures in the lungs called alveoli, which help with elastic recoil. When these structures are destroyed, the lungs lose some of their ability to spring back during exhalation, which causes small airways to collapse. Over time, these changes become permanent, a process called airway remodeling. This means the airways stay narrowed even when the inflammation decreases. All these factors work together to increase resistance to airflow. During exhalation, it becomes especially difficult to push air out because the narrowed and collapsed airways block the flow. So, inflammation in COPD causes airway narrowing by thickening the walls, enlarging the muscles, overproducing mucus, and destroying lung tissue. This combination reduces airflow, making it harder to breathe and leading to the symptoms seen in COPD. Understanding how inflammation causes these changes helps us see why managing inflammation is key to treating airflow limitation in COPD.